Welcome and thank you for joining us today for the meeting of New York City Health and Hospitals Board of Directors. Today's meeting is officially called to order. So for the record, please note that Karen St. Hilaire is representing Molly Wasso Park. Dr. Michelle Morse is representing Dr. Ashley Vasan, and Erin Kelly is representing Deputy Mayor Ann Williams Isom in a voting capacity. And also Dr. William Fisher is representing Deepa Abula. So next on the agenda is the adoption of the minutes for the board meeting held March 30th, 2023. Are there any questions or comments? Can I hear a motion for the minutes? So thank you. Let me ask then for votes individually. Dr. Katz?
Yes.
Dr. Calamia?
Yes.
Yes.
Dr. Fisher?
Yes.
Dr. Morse?
Yes.
Para Lowe?
Yes.
Robert Nolan?
Yes.
Jack Kawatra? Jackie Rowe?
Yes.
Supagan? Yes. So minutes adopted. Let me then say a few things here. During the executive session, the board received and approved oral and written governing body submissions from NYC H&H Queens in Kings County Hospital. The board also received a biannual governing body 2022 Performance Improvement and Evaluation Plan written submissions from NYC Health and Hospitals East New York, Gotham Center, and the semi-annual governing body report written submission from NYC Health and Hospitals Elmhurst. And I would also like to report that I participated in Queens Hospital leadership session of the Joint Commission Triennial Survey. Compliments go to the leadership and staff, not only at Queens Hospital, but all the supporting central office staff. Basically, the survey went very well, and the Joint Commission team was very impressed with all the work and commitment from everyone at Queens. So congratulations and thank you to everyone. So also during the executive session, the board reviewed and approved the governance committee recommendation to appoint Hillary Jallon as Vice President for Quality Management. So congratulations, Ms. Jallon. Working with you at H&H for a long time. Thank you. And also, let me move on to, so board member Jackie Rowe Adams, she visited Kings County, Bellevue, Harlem, Elmhurst, and Metropolitan. Would you like to share any brief highlights of all these visits?
He made sure he said brief because see, I could be here hour. Just let me say to the board, thank you for the support of me going out to these different sites. It's so important. I didn't realize it was that important, but I went out and I had a lot of fun visiting them because when they come here, all we hear the glory and the bad and this, but I went out to see the good. And when I go there, I say to them, don't be nervous, don't be jumping, I'm here to help you. You know, Dr. Katz would love to know all the good parts, and you don't have time to come here and tell us all the good parts. I said, so I'm here to support you and to see the goodness of the hospitals, because with the goodness, our staff and the patients, they benefit. So with that, I just want to, I can't highlight everything, of course, so let's talk about Harlem Hospital. When I visit Harlem Hospital, the highlights, I'm just giving you some highlights was, you know, it was an incident at Harlem Hospital with the security. And they took down this young man that had a gun. And they came in the hospital fighting and, you know, because somebody was shot. The security immediately jumped into action and took one of them down. But you know what? The directors, the CEO said he was in it too. And so when I was giving the security all the credit, he said, I was in it too. He was excited. But on a serious note, that was brave. That was brave for them to take him down. And when they took him down in the book bag, it was a big, long gun. Okay. And so I applauded them. That's one of the highlights. They did recognize them, you know, at a ceremony. And that was so key. The other piece is a lot of the hospitals, as you know, have shortage. They need staff. A lot of staff is still want to stay home and do the work, nurses shortage. But one of the things Harlem Hospital is doing is working on filling those slots. So I told them anything that we could help with, please let us know. So I'll just leave it there with Harlem Hospital. It's so much, and they do a huddle. They do a huddle each week on safety, because that's the key right there, right now in Harlem Hospital. It's the safety piece. So I'll just leave it there. I could still go on and on, but the team was really good. I did not get to meet all of the team because that day it was real busy, and but I will get to meet all of the team. So let me talk about Metropolitan. Metropolitan was great, but Metropolitan emergency room really need to be expanded. So if anybody have any extra money, give it to Metropolitan because their patients, and you know what was impressive to me, as cluttered as they was, nobody was yelling, doctor, doctor, nurse, nurse. It was contained. I said, did y'all talk to them and tell them I was coming? But they really do need help with the emergency room. They have the most beautiful Pride Center that they just opened. And let me tell you, oh my goodness, I went in there. It was so beautiful. I said, is this the emergency room? They said, oh no, this is our new Pride Center. So if you get a chance to visit, please visit. Each room is they have their own separate rooms. So when a Pride patient come in, they feel, you know, like they have a sense of just people caring for them. And personal, it's personalized. So let's support that. And Dr. Katz did see it. And so others need to go see it. That's a new piece for Metropolitan. There's so many things in it. I went through the first floor. Really, really, really beautiful. They're doing a lot of work and they have different departments, a lot of growth. Okay, that's Metropolitan. There's so much more. Let's talk about one of somebody's favorite hospital, but we can't tell nobody, Bellevue. Bellevue is historic. It really is. One of the things that really impressed me with Bellevue, they're not begging for nurses. They're smart enough and they're wise enough, which all hospitals are, but they're fortunate enough to have the fellas. You know, the fellow nurses, they work with an organization that's sending nurses. I think it's temporary. It's a temporary piece. And so they have their share of nurses. But they're so historic. I don't know if anybody went in there and saw the ambulance. It's the, now how my page got lost? It's the new versus the old. And they have this old ambulance truck that used to, back then the days when we wasn't born, and then they have the new, and I mean it's really beautiful. Then you have Bellevue really, really working on the different floors to expand, but their main thing is the nurses. They really are good with those nurses of growth, and like I said, everybody have their little issues, but the main thing is trying to work as a team and enhance them and reach it. My whole word is reach out to the board. Reach out to the board because it is help there. Don't say you could think you could do it by yourself. I'm learning that too. Don't think you could do it by yourself. Reach out to the board. It's more about Bellevue, but if y'all, I hope everybody get a copy. I hope everybody, the board members, get a copy just to see the work. So let's talk about Elmhurst. Elmhurst have the most beautiful pediatrics. Their pediatrics piece is really great. Have you saw it? Let me tell you, the kids, it's like artwork. And the kids, when they come into pediatrics, they go to the wall immediately and they can see and spell the words and tell the characters. All of this is so, that's what I look for, the goodness. and the kids are happy, even though they know they're going to get shots and stuff. Yeah, so they're excited. Most kids will start crying as soon as they go into the doctor.
They don't want to go in.
Yes, yes. So that was one of the highlights. Let's talk about Kings County. Kings County, as they were here today, they gave me a tour, and if you go out there, put some good shoes on, because walking through those hospitals are big. Oh my goodness. But let me tell you, Kings County, I'm impressed. They're doing a lot of renovation, and they're trying to do their emergency, bigger, making their emergency room bigger. And just going out there to Kings County made me realize that because it's people talk about Kings County, people talk about Harlem, but let me tell you about Kings County. They service so many people, and the people from the community, they was in there, they love Kings County. And Kings County, they doing a lot of construction, but the operation is still going on. And some of their highlights is making sure that their patients are safe. Safety, the security was great. The security need more money, of course, always. And that was the talk, but the security is great. And I was really, really satisfied with Kings County. It's so many pieces to that, but I'll leave it there. Their goals, I'm gonna tell you the quick goals. Better healthcare, join in having joy in work, and better values. Now, that's King County. That's their strategy goals. So I think did I cover all of them? Or did I do Elmhurst? Yes. So I just want to say to the board, thank you. I'm enjoying going out there. It means a lot to them. When I go out there, they looking, oh, okay. What's she looking for? I go out there and say, hello, listen, I'm so happy. They relax, they join in, and this is what's needed from the board to make them know that we care and we're there to work with them and we want to see the goodness, and they don't have time to bring all the goodness here. Mm-hmm. So that's my report. I did it fast, right?
You did it great.
Thank you.
Thank you. And so, Jackie, you were also at the NYC Health and Hospitals Behavioral Health Reception at Gracie Mansion on April 25th, and Robert Nolan was also there. So I'll ask Robert Nolan to say something about your visit, and if you want to add anything to it, please.
Well, I can say that both Jackie and I had a wonderful time. It had been several years since I had a chance to go to Gracie Mansion. We met somebody who works on the inside, had just been transferred from another agency. We got her contact, and she's invited us to come back. Mm-hmm. But I want to say that there's a wonderful young woman who works at Jacobi Hospital who spoke eloquently about her own experiences in that program. Dr. Katz had always the right words to say, as well as our deputy mayor, who spoke so well. There are about 50 people there. These were donors who make a lot of things happen in our system. Nice. And I think that we really enjoy the opportunity to be there at Gracie Mansion, to be there in support of health and hospitals, and to be in support of our deputy mayor and our president. It went extremely well. I had to leave to go to another meeting in the Bronx, so I was only there an hour. But the big accomplishment we both did is we were able to sit on that nice couch.
Yeah, what was it?
Lean, all I know is we not only got down onto the seat, we actually got up onto the floor without having any accidents occur. So I was very pleased at that major accomplishment, which most of you was looking around the table and had to deal with. But it was a great event. It was a wonderful opportunity to get together and to thank a lot of people who needed to be thanked. I want to thank you for inviting us to attend.
Absolutely.
Thank you so much. And also Michelle Morse was there. So thank you so much.
Yes, it was nice. And just let me say that one of the highlights was the vegan food.
Mm-hmm. Is that what it was?
Really good. Those hors d'oeuvres was good, right? Especially them hamburgers. I'm telling you. So the vegan food was really good. And on a serious, it's all serious, but just to say, I'm very proud of Dr. Katz. I'm very proud of our deputy mayor, because everybody felt relaxed. It was like a reunion,
Yeah.
because you see all the health and hospital, and they came up and they would compliment me. They knew me, and they knew, the team, and they knew that the board is going in another good direction. That's important, and they do it. They have said that. And the direction is, it don't make them nervous or scared or whatever. It's like inviting. And this is what was said there. And so it was a good meet and greet. And thank you for inviting me.
Thank you
for
for-
coming.
Thank you for your comments. And so let me then continue with this. So please also be aware that the fiscal year 2023 annual public hearings, they have been scheduled for each borough. These meetings will convene at 6 p.m. There's 2 meetings left, one in the Bronx for May 16th at Jacobi Hospital, and another one in Brooklyn on June 13th at Woodhull Hospital. Looking forward to seeing you on those. Members of the community are encouraged to register to speak by contacting the board office at 212-788-3360. And this information is also posted on our public website. So let me go to Vendex approvals now. Since we began the process of approving contracts prior to Vendex approvals, there are no items on today's agenda requiring Vendex approval. There are 2 items from previous board meetings pending Vendex approval. One approval was received. We will continue to notify the board as outstanding Vendex approvals are received. So let's move on now to the President's report, Dr. Katz.
Sure, thank you. Well, following updates by the CDC, late last month, we began to offer the Pfizer BioNTech bivalent vaccine as a single-dose booster to children 6 months to 4 years of age who completed their primary series of the monovalent vaccine at least 2 months ago. The CDC has also added COVID vaccines to the child immunization schedule, which will make it easier for us to vaccinate children as part of their regular vaccinations for school. We are almost at the end of the federal emergency, but of course we'll continue to provide vaccination and Paxlovid and medical care. We'll just do it as part of our regular work. Our department has been very active in trying to protect access to medication abortion. Dr. Allen, Dr. Wilcox, and Dr. Navis has been working to make sure that our services are comprehensive, and our General Counsel, Andrea Cohen, has spent hours poring over very confusing different state judgments to try to figure out what we can do to provide the most appropriate care consistent with law. We will maintain that our goal, to us, this is viewed as a health service. That's how we think of it. We think of this, that we are providing a health service, and we should be allowed to provide it in the safest, most effective manner to the people we serve. We're working closely to keep people on their Medicaid coverage. We've talked to the board before about when the emergency ends, people will need to redo enrollment. And Talia Schwartz, our CEO of Metro Plus Health, is here, and we've been working closely with them to get as many possible people into re-upping their eligibility. We continue to work on housing issues. We will double the number of patients receiving one-to-one expert support who are experiencing homelessness to find and apply for housing. So $10 million over the next 3 years to match approximately 600 patients a year with housing navigation experts from the nonprofit consortium Coordinated Behavioral Care. This morning, I was at Woodhull Hospital for our second supportive housing project on that land, on a previous parking lot. We're doing this in collaboration with Communilife, and it was a great event because where we were, which is on the site of construction, you could see the existing supportive housing. And Rosa Gill said 90% of the patients who were placed from Woodhull Hospital into that building when it opened about, I think it's 7 years ago, are still there, right? Stably housed. So again, sort of proof that homelessness has a cure, and the cure is supportive housing. If you provide supportive housing, you cure it. They're not homeless anymore, and they don't become homeless, right? They have a reason to maintain their housing. So it was wonderful because we're like next to the construction of this new building, and we're staring at a existing building. And I told the HPD commissioner, well, there's still more parking lot, right? We could always build another parking lot structure. Parking lot structures are inexpensive to build because they don't need ventilation, right? You don't need closed walls. So put up a parking garage structure, you can have the same number of parking, empty land. We're prepared to continue to give our land for the sake of housing our patients. We think that's a very appropriate use. We're in the highest score on federal hospital price transparency, and there are federal laws about hospital systems explaining both the cost of their services and what they're getting from insurances. And many hospitals do it in a way that completely obscures transparency. They have these huge spreadsheets that are unreadable for consumers to download. We got the highest rating with ours to show that we've done it. Thank you, Anna. I know your group has been responsible for helping to make sure that we are completely transparent about what we do. As an update for the humanitarian emergency response and relief centers, we have taken care now of 14,500 asylum seekers since the crisis began. We're very proud of that, especially given that we just celebrated Immigrant Heritage Week. And I mean, you can hear it in Jackie's talking about meeting our staff. So many of our staff come from families that used health and hospitals, actually including me, as they grew up, and returned to the system with a sense of giving back. And it's one of the things that makes health and hospitals such a very special place.
Absolutely.
Metro Plus Health also hosted a resource fair on April 21st to connect more Staten Islanders to the wide range of healthcare and social services support. We are working hard to keep childbirth safe for all. We recognize National Black Maternal Mortality Week on April 10th. And that we continue to want to make sure that we provide the highest level of delivery care to all of our patients. We especially believe in the power of our SIM centers to make sure that people are learning and practicing the very best of techniques. And on April 18th, we had celebrated our inaugural Faculty Development Day, and I want to especially thank, our chair, Jose, who was one of the special speakers, and Joan Reed from Harvard Medical School's first dean for diversity and community partnership. The event was designed to promote diversity, equity, and inclusion throughout health and hospitals, and make sure that our physicians have a clear career path that's going to be exciting for them and keep them engaged in health and hospitals. And with that, Mr. Chair, that ends my report.
Thank you, Dr. Katz. Any questions for Dr. Katz?
Thank you.
Okay. So there are two more agenda items connected to Metro Plus. So, Dr. Clark.
Afternoon. We are going to Dr. Eric Way as a member of the Board of Directors of MetroPlus Health Plan, Inc., a public benefit corporation formed pursuant to Section 7385 of the Unconsolidated Laws of New York, to serve for an additional 5-year term beginning April 2023 in such capacity until a successor has been duly elected and qualified or as otherwise provided in the bylaws.
Any questions or comments on it? So,
I just think Eric has a phenomenal way of morphing to whatever role we give him, and it's a really an incredible attribute.
I would just like and appreciate if you can confirm to me that there's just one Dr. Eric Way. Somebody else. And keep with my colleague's statement. He
can
seems to
confirm
be
that.
everywhere. He's in a senior position here at the health and hospitals. He's at any one of half a dozen hospitals over the period of the last couple of years, running it in between picking a new CEO. So I just want to make sure that
Good
he doesn't
quality.
have that unique ability to be able to triple himself and be in different places at another time.
He's also the
So
chair of
can
our
you confirm that,
CLAPI.
Mr. Chair, that there's one Dr. Way,
there's one.
so the record's confirmed.
Other comments, or you're very lucky to have Dr. Way working with you.
We are.
Yes, so,
Like I just mentioned, he also chairs the QAPI
Yes.
committee for us.
One of them does.
so on that note, I would like to ask for a vote. So all in favor, please say yes.
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 Opposed, say no. Okay. Reappointment done. The next one?
Next one. Reappointing Mark Power as a member of the Board of Directors for MetroPlus Health Plan, Inc., a public benefit corporation formed pursuant to Section 7385 of the Unconsolidated Laws of New York, to serve for an additional 5-year term beginning April 2023 in such capacity until a successor has been duly elected and qualified or as otherwise provided in the bylaws. Mr. Power is a member of the community who is covered by MetroPlus and represents MetroPlus in that capacity.
Any questions or comments? Okay, so on that note, all in favor, please say yes.
Yes.
Opposed, say no. So, thank you so much.
Thank you.
So the committee and subsidiary reports were emailed in your folders for your review and submission into the record. Are there any questions or comments about the reports? Is there any old or new business to come before this board? Hearing none, then the board meeting is adjourned. Thank you so much.
Was this
That's a new record.